Welcome to Lifestyle Matters. I'm Marilyn Moore. We are with Dr. Miner at Fresno Surgical Hospital, and we're going to be talking all about kidney stones, what they are, and how they can be treated. Doctor, thank you so much for joining us on the show.
It's an honor to be here. I appreciate it very much.
So, kidney stones. Tell us, what are kidney stones exactly? I just know they hurt.
They are a painful entity, unfortunately. Kidney stones form because of genetic and hereditary reasons, but also because of environmental factors. In the valley, we do have some issues with dehydration, poor diets, and unfortunately, calculi or stones can form in the kidney. When they first form, they're not painful. They're attached to the kidney, almost like an apple to the tree. But when they fall, they become mobile. They cause obstruction where the urine product cannot make it down to the bladder. And thereafter, the dilation or pressure buildup on the kidney causes the morbidity.
And how can we prevent something like this so it doesn't get to that stage?
Fresno is in a geographical area, and that travels down to Arizona, across Texas. We call it the Stone Belt. So we have obviously ambient temperatures. We're active lifestyles, so we get dehydrated. We need individuals that have a tendency to form stones to make 1.5 liters or more urine per day. So really hydration is the key. After that, we do ask for a low sodium diet and to monitor how much protein a person ingests at a single meal.
And how are these treated? I mean, is surgery always the option?
We always, I think good surgeons try not to operate. So we're going to be supportive. We're going to monitor the patient's overall health. An individual that's young, doesn't have a lot of comorbidities such as diabetes, hypertension, or renal insufficiency, we'll attempt to support them with medications to help them pass it. However, a lot of times, unfortunately, stones can get hung up near the kidney, in the mid-ureter, or down by the bladder, and thus we're ready with surgical intervention to assist.
And this morning you were even mentioning that you did a treatment. So can you tell us about what you exactly did?
We're proud to offer state-of-the-art technology in a timely manner at the Fresno Surgical Hospital. A very young individual, unfortunately presented with a 6-millimeter stone down by her bladder, severe pain, nausea, vomiting, and of course time away from family and her employment. We met her, and within 48 hours, seeing that the severity of her dilation reached a critical point, we traveled to the operating theater this morning for minimally invasive techniques.
I mean, you mentioned a few of the symptoms. Can you talk about some of the symptoms someone might be experiencing?
When a stone first falls, oftentimes it's going to be a classic backache, also known as flank pain. It's typically where someone cannot reach a comfortable position. Laying down, seated up, or standing is still going to be painful. When pressure reaches the renal capsule, because urine is not passing downwards, you'll have the nausea and vomiting initially. As the stone progresses down, you'll have the radiation of pain to the anterior lower quadrants. It oftentimes on the right sides can mimic appendicitis. And then all of us, taught by our moms, when our bladder fills, we feel an urgency to urinate. In these cases, however, it's the stone causing the discomfort to the bladder. And so someone will feel significant urgency to pass urine, but it's not volume-based. It's the stone causing the problem.
Well, that's good to know about all those symptoms. I mean, there's so many, and that's why I'm sure most people don't realize what's really going on inside of them. What about technology-wise? I know Fresno Surgical Hospital has a lot of great technology. Tell us about that.
We have not only senior expert staff members, but also it's wonderful to offer minimally invasive techniques such as fiber optic, endoscopic lasers, and then state-of-the-art shockwave technology. Based on the size of the stone, the location of the stone, we'll choose either one or both modalities to help assist that patient without ever making a cut on their body.
And for recovery time, I mean, is it you do the surgery and they're good to go? They're good to just walk off?
It's nice that the majority of the cases, especially if we can provide a stent inside promoting urine drainage from that side of the kidney, that these patients are able to go home the same day. Oftentimes the next day they'll be sore, they'll pass some blood in the urine, but overall the morbidity from these surgeries are very minimal. In the years past, literally 1 or 2 decades ago, unfortunately there was a high rate of mortality with such stones.
That's amazing. And tell us why you love working at Fresno Surgical Hospital.
It starts and stops with the staff. It's a family affair. We have amazing nurses, secretaries, administrative support. And so I think for us as surgeons, we go in with low egos. I think if you walk in and you become part of the family affair, the patients simply benefit from a great outcome.
Doctor, thank you so much for joining us.
It's nice to meet you, Marilyn.
And viewers, if you're interested in learning more about kidney stones or seeing Dr. Miner, please visit Fresno Surgical Hospital's website or give them a call. You're watching Lifestyle Matters. I'm Marilyn Moore, and we'll see you next time.